I am Pam Ludwig. I'm the owner of Pretty in Pink Boutique, and we started this business in April of 2004. We decided that we were going to just help a few women in the Nashville area who had been diagnosed with breast cancer and might need post-breast surgery products. So it quickly evolved into something much, much larger than that. And now we have 4 locations in Middle Tennessee. And we serve not only breast cancer patients, but also patients that have needs for compression garments as well. We see burn patients, pediatric patients. But our heart is with breast cancer patients, since that's how we started. I started Pretty in Pink Boutique because I lost my mother to breast cancer in 1994. And after she passed away, I decided to go back to school to become a nurse. I was really moved by the whole experience my mom had with her breast cancer journey. It was a short journey. She was stage 4 when she was diagnosed, but all during that process, I was with her all along the way. I was with her, the moment we lost her too. And I just realized in that moment, really, in the few weeks leading up to her death, I just realized I had a calling to be a nurse. And so I went back to school. I'd already graduated college. I was in graduate school for something totally different. And I went back to college to become a nurse, and immediately went to oncology. I was a bone marrow transplant nurse at Vanderbilt. It was my first job out of nursing school. I learned an incredible amount there, but again, got to stay in the realm of cancer patients. And that was really what was dear to my heart. And so then I had a baby. My husband and I had a baby. And I just didn't want to go back to nursing 12-hour shifts, with an infant at home. And so we started coming up with different things to do with my expertise and my skill set, and really where my heart was. And so my husband actually had the idea to start a store for women who had had breast cancer, because he had been on a plane coming home from LA and spoke to another woman next to him who told him about a friend she had in LA that has a store for women that have breast cancer. So that's kind of how it all started, literally on the back of a napkin at J. Alexander's. My husband and I took notes of how I was going to serve a few women a week, like I said, because we had no idea the need was so great for this type of service, this type of ministry. And when we started the business, there were several other places around the Nashville area that had, I guess you'd call them durable medical equipment places, that also offered some breast prosthetics, bras, different post-surgery items, but it wasn't their main focus. And so we knew quickly that Nashville needed something that this would be our main business. We would aim to serve simply breast cancer patients, any woman going through a breast cancer journey. So when we started off, like I said, it was just sort of going to be almost like a part-time thing. And it was just me in an office by myself. And these women just kept coming. They just kept calling. They just kept coming. And there was such a need for what we provide, the services we provide, the products, of course, but most especially a dedicated space for women walking this journey that felt like they were being heard and seen. And like I tell people, everybody that walks in this door is somebody's mom or somebody's sister or somebody's daughter. So I just look at that all the time. Like, someone walks in there, they've just been diagnosed with breast cancer. Maybe they're frightened of the journey ahead. And I've already been through this with my mom and with thousands of other women who've been through it with their families too. We wanted them to have a place to come and feel safe and heard. So like I said, Pretty in Pink was started to support women who had a mastectomy, lumpectomy, any type of breast surgery after a diagnosis of breast cancer. And so what we do is provide all types of post-operative garments, anything necessary to restore breast symmetry after surgery. And so how we aid in the treatment process is we're not just providing garments. We don't just sell stuff. We're really a full part of the treatment team. So we've been here so long now. We have such wonderful relationships with all of our surgeons in the area, all of our oncologists, and also lymphedema therapists, physical therapists in the area who provide lymphedema care, that we all work together as a team. We share patients, and we share information, and it even comes down to maybe one of our staff members lives close to a patient and will drop their item off at their home, or maybe we know that patient's going to see the doctor over at Williamson Medical and she lives far away. We'll arrange to get that item to her at the doctor's office, because we're all working together. We're all communicating and working together. So our role is to be a part of the team. We want to be a part of the team. We don't want to just, sell you a garment or provide you a garment one time and, wish you luck. We're here to be a part of the whole journey. So the day you get diagnosed and you walk in, with that deer in the headlight look, your surgery's been scheduled and you're just not sure where to go from here, we love to say to you, hey, we know hundreds of people who have been through what you've been through. So, we like to get their age, their stage of life. It doesn't always make sense to connect a 25-year-old with an 80-year-old, right? But you got maybe a 25-year-old who has a young child at home, and immediately our fitters, our staff, knows someone else who's 25 and has a young child at home. And we connect those people with their permission, of course. Would you like to talk to somebody else who's been through what you've been through? There's been a lot that has changed with breast cancer treatment since my mom went through her journey in 1994, and here we are in 2022. Even the short period of time that I was an oncology nurse at Vanderbilt, just the advances they were making and the things they were cutting out, realizing what things didn't work, what treatments didn't work. And my mom's a great example of that, because my mom actually had a stem cell transplant back in 1994 when we were still doing stem cell transplants for breast cancer patients. And actually, when I was a nurse at Vanderbilt in 1999, I remember getting a letter, our unit got a letter, and that was shared with all the nursing staff that basically said, hey, we kind of realize now that stem cell transplants don't really work for breast cancer. It's rarely used now except in certain situations. So I look back at that and I think, oh, wow, my mom did this for all of these people, right? My mom went through a very, very difficult journey. She was very ill, and it didn't work for her. But what it did do was work for others, because now we don't do that anymore. We know that treatment isn't successful in the treatment of breast cancer, or really in solid tumors at all. Very successful treatment in different types of cancers, but not in solid tumors typically. So that was really a kind of an eye-opener for me once I realized that my mom did this for other people. Like her life was not lost for nothing. And so watching these women walk this journey now, and I remember a text thread I had with a patient years ago, a very young patient. She was 32, and she was texting me, kind of telling me how she was doing, and she was saying, I'm on a new pill, I don't like it, it makes me sick. And she said, I'm literally standing at my vanity right now, I don't want to take this pill because I know it's going to make me sick. And in that moment, I had this lightning bolt of, okay, what can I say to encourage her? And I remembered this story about my mom. My mom had a stem cell transplant. It didn't work. She passed away. We don't do stem cell transplants anymore because they don't work. We have different treatments now. We have this pill that might be making you sick, but you are not just taking this pill for yourself. You're taking this pill for all the women who come after you. So I said, Leslie, take the pill. Take the pill. It's not just for you. Because I knew her and I knew her heart, and I knew that that was going to be like rally for her, right? A pep rally. Like I can do this. I can take this pill. I might feel sick today, but this will help us all learn what's going to work for these women. And so now, 2022, when people come in and they're terrified and they've just been diagnosed and they walk in, and we call it the look. They walk in usually with arms crossed, some sort of protective mechanism. They have what we call deer in the headlight look, and they walk in, you just know they're terrified because they've just been diagnosed. Their doctor told them to come here to get the garments they need for after surgery. And we love those patients because we know just what to say to them, and we know to say, hey, you're going to be fine, because now we know what doesn't work. We know about the pill that makes you sick, may or may not work. We know all of these things now. There's so many new treatments out there. A lot of them are oral pills now, which is so much better than the infusions that used to make people so sick. So it's really an honor to say that to somebody when they walk in. They've just been diagnosed. It's an honor to be able to say to them, you're going to be fine. And we have 4 members on staff who actually have been diagnosed with breast cancer themselves, or survivors. We call them thrivers. And I love to say, look at Holly. Holly's fine. Her hair's back. She's beautiful. She's dressed cute. She's at work, right? You can do all of those things too. So for women who have not had a mastectomy and may have had what we call breast conserving surgery, that would be a lumpectomy, partial mastectomy, those women often fall through the cracks because They go to their surgeon, they have a small amount of tissue removed from their breast, and they kind of, move on about their way. And what can happen is that the majority of those women who do have a lumpectomy or partial mastectomy are going to have radiation. And radiation can change the density, the shape, the size of the breast over time, because radiation can kind of draw tissue in, make it smaller. And so what can happen is 6 months, 9 months, 2 years after your lumpectomy, you might see some changes in size of the breast. So that's when you would need us, right? So that's why we try to, really work with the physicians and the nurses at the physician's offices to really tell those patients who are having a partial mastectomy all that's available to them as well. Every time I get a lumpectomy patient in front of me, I take the opportunity to say, hey, this is all you need right now. This post-surgery garment is all you need right now. But just remember, if you ever put on a sweater and look in the mirror 2 years from now and say, hey, something doesn't look right. Oh, I remember that place I went to get my post-surgery garment. We're always going to be here to help that. We can restore symmetry pretty immediately with a bra by itself. We can restore it with some padding. We can restore it with a prosthesis, a partial prosthesis. There's a whole gamut of products available just for that particular patient. So I don't want them to fall through the cracks. They're just as important. They've had a diagnosis of breast cancer just like the woman who chose to have a mastectomy. So we want to make sure that they know that this service is available to them as well. There's a lot of products specifically for that type of surgery.